Danas, evo, javljamo se ponovo iz specijalne bolnice Sveti.
We're in Special Hospital Sveti again. Today we're going to talk about retinal detachment, a problem related to the posterior segment to the retina and vitreous body. Surgery that addresses the problem of the retina and vitreous body is called vitreoretinal surgery. Around a decade ago, Sveti introduced posterior segment surgery in these areas, thus introducing a less invasive approach with the so-called 25 and 23 gauge surgery, which has become applicable today as a surgical approach in posterior segment surgery. What is retinal detachment? Retinal detachment is a condition urgent for treatment, urgent in ophthalmology. It comprises the separation of the retina from its foundation, which causes the loss of visual function, and it is dramatic because it may end in blindness if not treated in time. When does it occur? There are several types of retinal detachment. One of them is the so-called rhegmatogenous retinal detachment, comprising a rupture in the retina, which is most often a consequence of degenerative changes that may be congenital or that may occur during one's life, particularly in myopic or high myopic persons in whom these retinal structures are thinner and eye coatings are thinned and liable to such situations, as well as in cases of traumas. Then it can occur in diabetes and systemic diseases in which changes in the entire posterior structure occur, in the vitreous body, in frequent hemorrhages and proliferation, in fact tracking, let's call it scar changes that track and tear the retina, thus causing ruptures and subsequently detachment. The third group includes secondary retinal detachments, behind which are much more serious primary disorders such as tumors or some systemic diseases of the eye coating within a systemic disease that may even be meta-changes. Surgery that addresses this problem is vitreoretinal surgery, which is performed in general anesthesia, very comfortable today owing to this modern approach that we've made available in our domestic ophthalmology. What's very important is the right time for surgery. It's best that the patient comes in time when he notices first discomforts which may be quite unsuspecting, such as flashes, the sensation of lighting in the eye, and then blur of vision, the sensation of a falling curtain, as patients often call it. This must be taken as an alarm for an urgent ophthalmologic examination with a good insight into the structures of the retina, a good examination of the posterior structures of the eye. And if any rupture or break is noticed in the retina, the patient must be urgently referred to the center where preventive laser photocoagulation perhaps may be performed in time, which would prevent retinal detachment. If this moment is omitted, the fluid from the vitreous body inevitably pours down, the discomforts worsen, and real retinal detachment occurs when surgery is mandatory.
Pogoršanje tegoba i nastanka prave kliničke slike ablacije mrežnice kada je hirurgija neminovna.